The AI applications I'm using, I think there's two that I think are really dramatic. One of them, I feel like it's a big game changer. I was just in the other room using it with a patient, again, got enthusiastic feedback, and that's using Doximity's HIPAA-compliant GPT. So where it impacts us significantly is in patient education. We talked about individualized medicine in terms of genetics. Now we're able to do individualized medicine in terms of patient education. And think about the power of that. Let me tell you a story. Patient, educated lady, very smart, 2 years, putting needles in her eye with injections, which is what we do, a big portion of a retina doctor's practice. Did not know why we were doing it. And I used this Doximity GPT to answer her specific questions of what the name of her condition was, how the medication worked. She's an engineer, so she likes to know all the nitty-gritty, and I was able to query the large language model, which is what ChatGPT is, to give her precise information, text message it to her phone. She went home and read it at her leisure and was blown away that she had been spending 2 years letting me put a needle in her eye and not knowing how the medication worked or why she was doing it or what the name of her diagnosis was. So it's a very powerful technique for patient education. The second thing I like to use in concomitant with it is voice to text. They have specific medical application voice to text of Dragon Medical. For example, I can do voice to text at about 160 words a minute versus typing it maybe best. I'm at 50 words a minute. And what that allows me to do is communicate with referring doctors much more completely and accurately, because I feel free to give them all the information I need because I'm not restricted by the slow speed of my typing. So, and also using the voice to text along with the Doximity's HIPAA-compliant GPT, these technologies all start to merge, and all of a sudden, these technologies that are promising also don't impact your workflow.